All right, what's up, guys? This question is going to refer to insulin sensitivity in your off season, how to maintain a positive insulin sensitivity, and what to do to keep it positive, steps to consider, things to kind of consider and look out for, and just how to make the best of your off season from a blood sugar standpoint when you're pushing calories. All right, I just want to get cut right to the chase here. With a lot of the talk about blood sugar and bodybuilders and things of that nature, a lot of what's not talked about is growth hormone use. Okay, so I believe that our bodies were created to handle a substantial amount of carbs in a natural environment, and our pancreas is supposed to know what to do with those carbs and how to flush those carbs and utilize those carbs, get rid of the excess carbs, store the carbs, whatever they're going to do with the carbs. I think our body was created to handle that. Okay. But we are doing things as humans, as bodybuilders, to kind of make that a more complex environment, and growth hormone is one of those things. So growth hormone, whether you take it first thing in the morning, around training, whenever you take it, it's going to, over time, increase your fasted and fed blood glucose levels, okay? So that is what the main concern is. I don't think our focus needs to be, if you're a natural athlete, and the natural athletes is what I started coaching and started learning from coaches that coach natural athletes. If you look at their diets, guys, their diets are high in the off season with carbs. They're really, because carbs, that's the food that they can be progressive with. They don't have, compounds to use, drugs to use. So they have to be high with their nutrition in the off season. They don't have blood sugar issues. So the issue with enhanced bodybuilders is the entrance of growth hormone. Okay. So when you're using growth hormone, I would recommend that you use it as far away from food as you can, because we know it's going to increase over time your blood sugar levels as is, and then that increase is exponential when it's around food without the presence of insulin. All right, so these are important things to consider. All right, so when you are using growth hormone, I would recommend basically taking it first thing in the morning, and if you can prolong meal one for an hour, prolong meal one for an hour. If you can take your growth hormone in the middle of the night, take your growth hormone in the middle of the night, and then you might have 3 to 4 hours before your first meal. With growth hormone use, I think the most important factor is the consistency of taking it, like most things in bodybuilding. All right, so it's not so much the specific timing, and you might get 5 different coaches that tell you 5 different things on this, but guys, I've seen it tried every which way, and honestly, I think the common denominator in all the ways that it's tried is the consistency and how it's taken, and I mean that 100%. All right, so I'm kind of getting off track here, but not really, because I want to tell you guys the truth of what's really going on, and that is the biggest thing to consider when it comes to blood glucose levels in the off season while you're pushing food. Now, growth hormone aside, what are some other things that you can do? I do think that GDAs that are properly dosed are very effective. GDAs can be expensive. So with my athletes who are on a budget, who are on a fixed budget, who don't have a lot of money, I typically recommend that they take 1,000 milligrams of berberine HCl with meal 1 or meal 5 or 6. They're meals that are furthest away from training. I recommend that they take that. And this is also something that's a great aid. I've seen guys who are waking up with their blood sugars in the 110s, 115s, that over time, through consistently taking berberine HCl, it brings it back down to 94, 93, 92. Okay, so that alone is a great glucose disposal agent, berberine HCl, and that's kind of packs a big bang for its punch. So if you're on a budget, I'd recommend that one first, and then if you can afford others, obviously there's others to take as well. But berberine HCl and finding a formula that's based around berberine HCl is important to me. So that's something else I would consider. And then outside of that, just being mindful of your hunger and or your digestion throughout the day, okay? So obviously, if you are pushing growth hormone and you're pushing crazy carbs and you don't feel like you feel like you're bloated throughout the day, you feel like your body's not processing them very well, I would venture to say that your blood sugar levels are more elevated. All right, so make sure that you have a hunger response. Make sure that your blood, your food is cleared. Like, don't be so regimented to eat every 2 hours. Let that food digest, let that food settle, let it pass, and then go on to your next meal. All right, and then other things to consider as well is, like, let's say for example on an off day, This is a pet peeve of mine, so I'm just going to say it right now. Don't go from one extreme to the next, okay? Don't go from eating 600 grams of carbs on your training day and then pull it down to 0 grams of carbs on your rest day to improve insulin sensitivity. More so than insulin sensitivity, you have to remember individual metabolism. So if your body needs 600 grams of carbs a day to grow or to at least maintain body weight, why do you think you need to go down to 0? Like, I think a reduction to maybe 150 grams of carbs would be more than sufficient, okay? So that is something else that I take into consideration. First thing, if you are going to change your diet on an off day, I would look at the carbs that are based around training first, okay? So typically a lot of people, myself included with my athletes, I actually increase carbs around training, whether that be fruits, whether that be carb powders. So remove those things. And if you actually remove those things, that could be 75 to 100 grams of carbs right there, possibly even greater in some situations. And then don't change the rest of the diet, all right? Or if you're somebody that doesn't have a ton of extra calories or carbs around your training, then look at the diet, pull back maybe 25% as a whole in terms of carbohydrates over the day, and then go from there, okay? So, and then within all this, monitor your fasted blood sugar levels. If you're pulling, let's say 150 grams of carbs from your training day to your off day, and you're waking up after an off day in a fasted state with healthy blood sugar levels, there's no need to pull more, all right? And then lastly, when it comes to actually checking your blood sugar, make sure that you're hydrated, okay? So if you wake up first thing in the morning and you've peed 4 times throughout the night, chances are you're in a dehydrated state. If you didn't even really hydrate up the day before, you're definitely in a dehydrated state, okay? So I would recommend having about 32 ounces of water, wait around 20 minutes, don't take anything, don't have any food, don't take any supplements, wait 20 minutes, check your blood sugar, and then go from there throughout your day, all right? So that's some tips for basically keeping blood sugar in control, things to consider when it comes to blood sugar in the off season when you're pushing carbs. Hope this helps.